So I have a question here about colon cancer and hemorrhoids. So for colon cancer, this cancer means neoplasia or new growth. So anything that is a new growth along the colon, okay, which can be the cecum, the ascending, descending, transverse colon, sigmoid, and rectum. So any new growth on that area, that new growth that is dysplastic or neoplasia, like what I said earlier, so those are called cancer, colon cancer. So depending on which part of the colon is afflicted, so you would see symptoms. For example, if the tumor is found on the right side, most probably the person will complain of weakness, anorexia, anemia, and then he or she would notice that the poop is blackish or brownish in color, dark brown. It's because the bleeding, which is typical of colon cancer, the red blood cells had already undergone some form of breakdown. So if there's a breakdown, you will see them as blackish or very dark brown in color. So that's with the right-sided. Now, you go to the left side, that's where your sigmoid and rectum is located. You would have symptoms of obstruction. So it depends. So you can be constipated for a couple of days. So eventually, if the tumor is already obstructing the lumen of the colon, most probably if you go to a doctor, they might suggest a colostomy for you because there's an obstruction now. So you would also have bleeding. Now the bleeding, the typical bleeding that you see is reddish in color, bright red. So that's why it's the same with hemorrhoids, because with hemorrhoids, one of the symptoms also is bleeding, especially when you are in the internal hemorrhoids. Now, what are hemorrhoids? Hemorrhoids, also known as piles, if you're British. So these are the vessels going to the rectum. They're engorged and they become irritated. And after that, they burst, not really burst, but yeah, like burst. So they burst and then they start bleeding. So if there's no pain, it can be internal hemorrhoid. Now, when there's pain, itchiness, pruritus they call it, so it can be an external hemorrhoids. It can be very painful as well because of the nerve endings that are rich in this part of the body, okay? So the diet plan for colon cancer is that, of course, no sugar. Again, I reiterated that sugar is the food of the cancer. They have 96 receptors for sugar, and normal cell, they only have 4 receptors for sugar. So try to not eat also foods that would make you constipate. So there are certain foods that would make you constipate. Also very difficult to digest because most of these people with colon cancer, they have problems of digestion, eventually absorption. So that's in the end, that's why they become skinny. So try to avoid eating those type of food. For herbal, what I can tell you is that the best is guyabano leaves. So guyabano leaves, alugbate, okra, garlic, ginger, especially garlic. There's a lot of research about garlic that it can help manage cancer. So that's one of the best herbal remedy out there. And ginger as well, ginger very good. So you have to eat food also, I forgot, you have to eat also food that are rich in iron, like molasses. Molasses is very good. But you try to eat molasses because the true molasses, they're not sweet. So they're actually very bitter in taste. So Boston Sea has molasses on it. That's why a lot of people are complaining, Doctora, how come it's bitter? Because that's really how the taste of the real molasses is. They usually are bitter in taste. Okay? So So get a handful of all those herbs, you boil them 5 to 10 minutes, and then you drink them 3 times a day. So Boston C, the best also, 1 teaspoon 3 times a day. Megadose vitamin C, 1 tablespoon once a day. Pixie dust, 1 teaspoon 3 times a day. I hope that this video is able to help you. So please let me know how else I can help you. Bye! For colon cancer, you have to ask yourself, did the person underwent some form of procedure? So, nagkaroon ba siya ng operation, radiation, chemo? So, usually patient to have undergone some form of treatment, okay, these are the people that are very difficult to treat because the body has some form of resistance. Nagkakaroon sila ng resistance. Mas matapang yung cancer cells. They're more virulent. So it's more difficult to treat this type of patient. Now, if the patient is a virgin patient, okay, virgin, it means
they come to you untreated before,
untreated,
no chemo, no radiation, no surgical interventions.
A lot better.
Much better.
A lot better. They are a lot better responsive to natural medicine compared to those that have undergone. Now, how do you treat them? Of course, for me, if a patient comes to me, I change the diet first. So if there's some form of obstruction, I let the patient drink liquid. Okay, wag muna na solid kasi mahirap pag nag-solid, nagbara. So if there's an obstruction, there's gonna be an operation again. So you can see another operation if it has undergone some form of obstruction. So it's better not to eat foods that are very tough to digest. Okay, ano ba yung mga very tough to digest? Meat. Very tough to digest, okay? But if you can eat meat as well if you liquefy the meat. So, pwede rin naman as long as you liquefy them. Yun lang kasi pagka nagkaroon na ka na ng colon cancer, yung mga pagkain na hindi mo masyado, that you have not chewed properly, it can get stuck, okay? So, you change the diet.
Well, oftentimes doctors are giving folks the advice of, if you have cancer, don't eat red meat. You know, there was I know you plan on publishing it here very, very soon, but there was a 2004 Harvard study that looked at over 1 million people and found no elevated risk as far as cancer is concerned by eating red meat. But what they did find is a significant elevated risk by eating those processed meats.
Yeah, like hot dog, bacon.
And why is that?
Yes, because meron siyang substance in the processed meat that can cause cancer. Nitrates, yan, diba? And nitrates can cause cancer, most of them associated with stomach cancer. So, hindi maganda. So, anyway, let's go back. Si Sir Jack. Sir Jack is messing me.
My apologies.
So, let's go back to colon cancer. If you have colon cancer and it went to the liver, so the most important herb there is garlic and guyabano. So garlic and guyabano, and of course ginger. Sanskrit, di ba? Sinabi ko na sa inyo, universal medicine. So yun ang pwede ninyong inumin as herb. And Boston C, megadose, vitamin C, and pixie dust. You know, yesterday I was talking to one patient in Facebook. She was megadosing. She was taking 3 tablespoons of Boston C twice a day. And she was taking vitamin C for like 2 tablespoons twice a day as well.
And now she bench presses Chevy Suburbans.
And she said that she feels so good. Okay, so kilala niya si Butchoy. Hello daw, Butchoy. Yun ang sinasabi niya. So, you know, you can, it's not gonna help. It's not gonna hurt you if you do megadosing as well. Especially if it's just for short term. Hindi naman siya long term eh. Anything that you take in long term, medyo nagkakaroon tayo ng problema. But if you take it in short term megadosing, it's very good for you. Your body just removes it.